So I was part of the London Global Cancer Meet held on November 16th, and my presentation was on what is required to advance data ethics, data sharing, and open access. Then, according to me, the why the reluctance on part of what is the hurdle to why the LMIC investigators are reluctant to participate in collaborative studies is mainly because of the hectic cancer load they have to handle day in and day out. The LMIC, as we are all aware, LMIC investigators handle about 80% of the global cancer burden under a resource limited setting, and this leads to and achieve a survival which is much lower than the high income countries, which will be emotionally and physically draining to the academic investigator, so that they will not have any time which can be kept aside for dedicated research. That is a main problem. So how we can overcome this? This is possible only if the LMIC investigator is empowered in terms of one, manpower, second, infrastructure, and third is technology. Because one or two people work throughout the week to give care for the hectic burden. So only if this is provided, the LMIC investigator will be able to participate in the collaborative study and thus initiate the research. That is the number one thing that is to be done. So how this can be done? This can be done by providing funding by the high income countries. But one thing to remember is the funding is to be sustained. It shouldn't be abruptly stopped upon completion of the recruitment of the patient. An example to quote would be, suppose that in a high-income country for a particular cancer having 20 patients per year, it will take to recruit 200 patients for a study needs about 10 years. Whereas on collaborating with an LMIC country having 80 patients per year, the same study can be completed in a span of 2 years. So but for this, the high income country needs to provide funding in terms of manpower, and the manpower needs to be in terms of the medical doctor as clinical coordinator, so that the LMIC investigator can entrust part of the clinical work related to that research to the medical person. Nursing staff is required for data collection as well as the taking informed consent as well as the sample collection, and data entry operators, psychologists, so on and so forth. And second thing is infrastructure. We don't have any electronic medical records. We have to do it physically. So what is to be needed is provision for electronic medical records or the high-end IT technology or data access, data entry platforms and high-speed internet, etc., to be provided so that we can complete the research within the limited time available to the LMIC investigator. And the third thing is analyzing platform. That also initial analysis of the whatever research done in the data collected in the LMIC. The LMIC researcher also need to do the initial analysis. This is possible only if the platform, data analyzing platform is provided. So having empowered the LMIC investigator, these three, they will be encouraged to participate. But if the funding should be sustainable, so it should be given for some more period after the completion of the participant recruitment. For example, 10 years needed in a high income country can be done within 2 years in association with the LMIC, but the funding needs to be continued for say 5 or 7 years, so that the gap in the technology, manpower, all these in the LMIC can be bridged to an extent. So having done this, the LMIC investigator will be willing to participate in the collaborative study. So once they are willing to participate, next come the ethical issues. So it can be divided into 3 broad categories. First is we have to respect the participants and respect the communities. That is the number one issue. Second issue is data governance, and the third is data sharing. So first, let us take the respecting individual participants. So what is required is we should initially take an informed consent. So most of the researchers what they favor is a broad consent, but it may not suffice in all the situation. Some situations require specific consent. An example would be a genomic study or where the identity can be revealed. Another example would be survivorship study, or in some situation, for example, in pediatric studies, a child who has given his sample for a pediatric research based on parental consent, when he becomes an adult and the same sample is to be used, the patient is to be contacted again and re-consent taken. So, in other words, the investigator must ensure that appropriate consent process is in place. So, what having ensured that the consent taking process itself is going to be time consuming in the LMIC setting, mainly because of many reasons. One is low literacy rate, language barriers, language diversity, and the lack of exposure to health research. So they need more time to be convinced about the informed consent process. So how this can be overcome, we have to involve more and more health professionals like nursing staff or somebody to take the consent, so they can spend more time with them and involve them, make them understand what is the entire study plan, what is going to, how the sample is going to be collected, how it is to be stored, how it will be used for future. And also they should be given the provision of withdrawal from the study, and how realistic this is going to be is also to be ensured. So that is one thing. Then second issue is, having taken the consent, next issue is how we are going to maintain confidentiality, privacy and confidentiality. This can be maintained by de-identification of the data and anonymization. But again, some specific situation requires re-identification. An example would be a survivorship study or a genomic study, where we have to periodically re-identify the patient and then enter the details. So how this can be done? Again, this should be routed through the investigator or the LMIC investigator who has collected, so that he can do it in a better manner, maintaining the privacy and confidentiality. So that is about the individual participant, how we can respect the individual participant. Now coming to respecting communities, religious communities, they are also taken into confidence for completing the study. So this can be done by community engagement, either of the whole community in case of vulnerable communities, or representatives from community can be included in the study process. They should be explained about the whole process. This will be costly and time consuming, but it's going to ensure trustworthiness, and it will alleviate the fears of discrimination and marginalization. Having done that, then again we have to remember it shouldn't be an one-time process, it should be an ongoing process throughout the study completion, so that they will realize what is going to be done with the sample collected, data taken, and how it is going to be used. So it becomes religiously acceptable, and the participation will continue. So having done that, the first part is taken care of, respecting communities and respecting individual participants. The second issue is data sharing. Though the data collection is the most difficult part in a collaborative study, which is usually majority of it is contributed by the LMIC investigator. But because of the hectic clinical work he has to do, he will not be able to do the initial analysis faster. So what happens is there will be some delay. By that time, the high-income country investigator wants the data to be transferred. Because of the availability of the high-end IT technology and the analyzing tools, they will be able to do the analysis faster and publish it faster. What is happening is due credit is not given to the LMIC investigator, and because of that, they fear that they suffer in career advancement when they share the data. That also pulls them back from the participation. So how this can be overcome? We will have to, due credit is to be given. because there is the value attached to the first, second, third, and the corresponding authorship often leads to competition rather than collaboration between the investigator. And in this race, the LMIC investigator often gets sidelined to least important roles, and they will not get any credit. For career advancement in LMIC countries, they also need publication. So if this can be appropriately addressed, then the participation again is going to increase. So how this can be done, a suggestion would be, one way is to enlist all the authors or the collaborators in an alphabetic order with true honest description of their contribution against each of them, and enlist all the authors in alphabetic order so that the contribution can be known. Or, the authorship may be first, second, third corresponding is to be given. That is about the initial thing. Then second is the LMIC investigator who has contributed to the majority of the data will be in a better position to lead the secondary analysis. He'll be in a better position to generate the subsequent study questions. So, but he should be allowed, he should be empowered through training and workshop, and maybe through Zoom platform or online platform, they should be empowered so that they will also be able to lead the secondary analysis. Another thing is there is data sharing. The LMIC investigator also should be getting an opportunity to look at the data shared by others, generated by others for his own secondary analysis. They also should be empowered to write the manuscript and get the credit for that contribution they have made. If this is done, the participation is going to increase. Okay, so then having done the data, then though the LMIC investigator is theoretically given the data access, because of the lack of IT facility, some of the LMIC investigators are even unable to download the data. This is especially so with genomic studies, so that they cannot do anything with the access given to them. So there is the need for empowerment, and again it should be sustainable and it should be an ongoing process. So that is the second thing. Then coming to the third issue is data governance. How we can do that? Data governance should be efficient. It should be fair, and it should be proportionate. So if such a thing is possible, again the participation is going to increase. So what is required for improving the LMIC participation is we should forge a new social contract for data sharing, which is built on 3 pillars of trust, equity, and social value. If that is their value, trust, and equity. If such a thing becomes effective, what is going to happen is global investigators will be able to collaborate in a much, much better manner. They'll be able to work together, they'll be collaborate better, they'll be able to finish the research faster, they'll be able to publish better, and they'll be able to share more. And one more thing I would like to stress is open access. The cost is prohibitive. Most of the journals collect a huge amount for making publication in open access, which is often not affordable to the LMIC investigator, which again prevents them from participation. Recently, I got an opportunity for a publication in a international journal, and for making it open access around 4,000 euros, which comes to 1 month salary of mine, and then I have decided against. So if that can be maybe journals can make it free for LMIC investigator, then the participation can increase. So to conclude, I would like to say that I would like to conclude quoting Daniel Keys Moran, who said, You can have data without information, but you cannot have information without data. Maybe some sort of funding is coming, but it is not to the extent that is required to fill the gap that I was telling. So that is why maybe the support is provided until the recruitment is over, and then it abruptly stops. So the voice of the low and middle income countries is to be heard and is to be appropriately addressed in the global debate of data governance. Then only the participation is going to improve.